Welcome back to the chat room. I'm Angela Scott.
I'm Lisa Schneider-Cipriano. Thanks for joining us today.
How many of you have ever wished, if only I could move this to here, my body would be perfect? Joining us today is Dr. Edgardo Zavala, as well as his patient Alicia, who's actually had some of these types of fat injectors.
And procedures done. Alicia, what has Dr. Zavala, what kind of procedures has he done on you?
Well, the first thing I started off with a nose filler.
A nose
I
filler.
wanted to see what the results I would get. And I had a little bump here, and it made my nose look a little, just droopy. And he put a little bit of filler, picked up my the tip of my nose, and now it seems like it looks really straight. I'm really happy with it.
It's a very pretty nose.
I know.
Dr. Zavala, tell us about this actual procedure that you actually take fat from a certain area and you inject it into another area. Tell us about that.
Yeah, this is a procedure that we have been doing for quite a while now, and it's starting to be more common here in the US. And the most common sites where we do the fat transfer is to the face for people that have a lot of emaciation from weight loss, to the breasts to get you a natural breast augmentation without the need of breast implants. And another very important area is the booty.
Is the booty,
What we
the
call
J-Lo booty.
Or the Brazilian booty. It's so true about the J-Lo booty. So many people want that nice round bottom.
Yeah.
And the Brazilian booty.
Yeah.
Exactly.
I was in Brazil a few years ago, and I did notice the women have very tiny waist and very voluptuous bottoms, and it looks beautiful.
See, now that's not fair.
It's not always, and many of them don't have it by genetics. It's kind of the same procedure that we're talking about.
So a lot of them are actually having a procedure like this done?
Oh yes, Brazil is really the mecca of plastic surgery in the whole world, and they have developed a lot of these procedures. One of them is Brazilian butt lift, that we call.
Gosh,
And I understand that other countries are actually further advanced in the cosmetic surgery areas than we are here in the U.S., and you are actually only one of 3 doctors that offered SmartZide. Tell us about SmartZide.
SmartZide is just a laser resurfacing procedure called Fractional Co2. I was the first to bring it into this country about 2 years ago. And it's just a way of rejuvenating your face with a little downtime, 3-4 days maybe, but the results are really impressive. The wrinkles, the sun damage that you have, the problems with the sagging skin, all that gets much better after the laser procedure.
How fortunate are we to have somebody like you, basically in our hometown, to be doing all this stuff? I need to just bow here right now, because I think every woman is like, oh my gosh, if I could move this over to here, or if I could fix my nose, or if I could do that. Here's one of the procedures right now that looks like you are working on something.
What are you doing here?
That's a laser. That's a
a laser.
SmartZide dot laser.
Wow.
And we're doing some resurfacing.
And that's where it's the
on
little
that lady.
squares, right?
Yeah,
Okay.
yeah, it's the dot.
And that just erases all the fine lines and...
And the
Look at
blemishes you
that.
get from the sun damage.
Yeah,
you
we
can
get a
see
lot
there the
here.
laser being applied. So it's a very simple 20-minute procedure, and the only downside is the downtime, but it's really minimal, 3-4 days.
3 or 4 days. We all have 3 or 4 days just to sit at home and get some things done and recover.
Yeah.
She doesn't look like she is in any pain whatsoever.
No, we apply a numbing cream for about 40 minutes before the procedure, and then that's it. Really, you feel a little pricky sensation, but not much.
Alicia,
There you are.
There you are.
Now this is your nose after?
This is a before.
This is
The
before.
before.
Yeah,
Before. Look at
Now
that.
what were you not happy with?
You're a little bit of a bump.
It was It was a little bit of a bump, and then it was really droopy. The tip was really droopy, and I just wanted it lifted up a little bit so it wouldn't be so droopy.
What
and
other procedures have you had?
I've also had a liposuction, my abdomen, my back, and I had the Brazilian.
You did.
I have to have her
We
model
might
that
have to
booty
see that
here in a minute.
booty.
I've always had the hips, but not the back.
Right.
It was kind of flat, but the hips were there, so I saw it as a great advantage. I thought, I'm going to have my liposuction. I'm going to move. When I was little, I used to, say, if I could just move this part to that part. And it was just a kidding around thing because we knew it could never happen.
Well,
now it can.
it can,
As
yeah.
we continue
But
to
you
bow
know,
to
Dr.
him.
Zavala, the thing I've always heard about liposuction is that I've heard you can suck the fat out of a certain area. However, if you gain weight, it actually comes back in other areas. So maybe you weren't prone to gain weight in your arms. However, after liposuction, possibly in the thighs, you gain the weight back in the arms. Is that true?
Well, the reality is that once you remove fat from certain area, you decrease the number number of fat cells in that area. So the chances that you will get significant volume in that area again, unless you really gain tremendous amount of weight, is much less than other areas. So yes, if you gain a lot of weight, probably will be distributed to some other areas more than to the original liposuction area.
What's the difference between liposculpture and liposuction?
It's just a different terminology. I would say that every time we do liposuction, we want to do some sculpting and really get the best possible shape, not just suck fat out. That's not the purpose. Really just suctioning fat out without having a good aesthetic outcome in mind just doesn't make sense.
We all look to Hollywood nowadays for our standards, and they set some pretty high standards for us, especially as women. I know men, too, are feeling that pressure as well.
Yeah.
But as women, what is the typical age you're seeing that it's actually coming into you for some of these procedures? Is it getting younger?
Well, I've seen very young people, even teenagers that we see quite a few, and very old people. The oldest one I had is, of course, I didn't do the procedure, 92-year-old guy that went to the liposuction, but so it's a very broad range of ages that we're seeing.
Well, I think we all want to look our best, you know, and I don't really think that there is an age that is attached to it where all of a sudden we wake up and we're, oh, I'm 23, I want to look my best, and you know, especially with women, we all do.
We do, Lisa, and you know, it's so funny, we all make reference to that woman that we see that's in her 50s that's trying to look 20, and we see her and she clearly, we all know, sitting around that she's had a lot of plastic surgery. However, the procedures you're doing, they look a lot less invasive and they look a lot more natural.
Yeah, I don't do anything that requires general anesthesia. Everything is done under local anesthesia. It's an in and out procedure. And trying to accomplish the most natural result without any foreign substances in your body.
Look at the difference.
Look at the difference in her stomach,
Oh,
my
my
goodness. And her bottom, she looks like she maybe had the J-Lo.
Yeah, she had the Brazilian.
Wow. Now, what is the most requested procedure that when people come in, they ask you about?
Probably the Brazilian, the one that you saw there,
Really?
and now more and more the breast enhancement.
Yeah. See, now that would be something where I've always thought, well, that would be kind of nice to have, but then I'm so scared, and my mother's a breast cancer survivor, and I'm just, oh gosh, do I start messing around with that? But I think if I went to you, it'd make me feel very comfortable.
Yes, Lisa, now, you know, he cannot take you from an A to a D.
What?
No.
Actually, to a large C, we can.
Right, but that is true. You only go
if you can help me, I'd be so happy. Thank you.
But you do
I don't think you need any help, by the way.
Yeah, she doesn't. She's pretty darn perfect, I'll tell you.
Oh my goodness, I don't know, you guys.
But you do not take people 3 or 4 sizes, as some plastic surgeons do. You only
I
increase
try
1
to
or
keep
2.
things in perspective.
Keep
So
it real.
I try to convince patients that really their best result will be something within their body frame, not something that will look unnatural.
Dr. Zavala, how can people find you?
I'm in Chandler at Ciao Medical Spa and Vein Clinic, 2310 West Ray Road, so very close to the 101 freeway.
Thank you so much for joining us today,
Yes.
Alicia. Thank you so much for being
You're
here.
welcome.
When we come back, we're going to learn all about a tequila fest taking place this weekend. Stay with us.